digital budget book. And with that, Director, thank you so much for joining us today. Thank you for bringing your team, and the floor is yours.
Good afternoon. Thank you all for having us here today. I'd like to thank Madam Chair Porterfield for allowing us the opportunity to share our budgetary needs with you all today. Entering into our second year as a brand new office, I guess I can no longer say that. We're eager to share the great strides that we've made as a community. I also would like to thank the mayor's office and his entire administration. This work would not be possible without their continued support. Our budget and finance team, we worked closely with them throughout the last 2 years. And I would like to also give thanks to our entire OHS team who worked tirelessly out in the elements and partnering with community agencies. You'll see here on our agenda, this presentation, we will share with you about our functions, key wins, budgetary requests, and challenges as well. Here in front of you is a copy of our org chart, and our org chart, our leadership. I'm April Calvin, the director. To my right, I have Joseph Marsh, the AD of Finance and Administration. Another part of our leadership team is Allison Cantway, who came to us by way of the Office of Family Safety. And she's our AD of Planning and Research, and then Dr. Marvin Trotter, who's our AD of Programs. The entire OHS team consists of about 30 employees. We have one that's grant funded and 15 ARPA funded positions. We have held a very great, excellent vacancy rate. But this work is not done in a silo. You'll see here on the screen all of our community partners. There's probably more. So sometimes I should be careful when listing the partners there. Just want to make sure, but these are partners that utilize our HMIS database system. Over 40 partners that enter into that database system. We have a public-private partnership and all of the passion that comes along with leading in this space, such a large continuum of care. Local government cannot resolve these issues alone, and our ability to partner with over 45 partners are essential. Critical functions of OHS include resource management, data management, asset management, and building key partnerships throughout the community. We lead the convening and planning process on homeless efforts in our community. As data managers, we are honored to operate the comprehensive community database. We have improved data entry, access, collection, and overall quality within the last 2 years. Currently, we're about 6 months in of obtaining, we paid for a bridge to sync the data from the large local emergency shelter here so that we can have real-time numbers on those that are experiencing homelessness here in Nashville. We would also like to provide a deep dive, comprehensive dive into aggregating that data, and they tell compelling anecdotal stories. I would be remiss if I did not say keep our downtown providers like Room in the Inn, Nashville Rescue Mission, Neighborhood Health in your thoughts and prayers. Yesterday, within the last 24 hours, they've experienced some extreme situations. As resource managers, OHS coordinates the manner in which people are connected to the federal resources, aiding in the connectivity of resources and services in Nashville for the most vulnerable individuals. What does that mean? A lot of people ask, right? We don't have a caseload, nor do we carry direct case management for people experiencing homelessness. But our goal is to increase the access and services and housing opportunities by operating a system that allows for increased inflow into our database and swift outflow from homelessness. We also have a robust landlord engagement team. The landlord engagement team has been able to increase their partnerships from 150, 147-ish properties to 333 properties that are willing to lower barriers to provide housing to individuals experiencing homelessness. Our outreach team, I can't say enough about them. They are our frontline defense and our frontline offense, and our frontline, they experience it all. So they are out, boots on the ground. Several of you all know the outreach worker that is connected to you, and I love to hear the stories when they're doing ride-alongs with you all, or Council Lady Webb's in the encampments and Hannah's having to get her out of there. I appreciate those stories. So thank you so much for that. That support is essential. Achievements. Now, this slide is a little busy, but that means there was a lot of great achievements. Next time, we'll break them out into smaller slides. On average, our community partners, we house nearly 2,000 individuals per year. 47 active agencies, and then incorporating the Nashville Rescue Missions data. But one huge win this year was we were able to decrease the number of people dying on the streets of Nashville while experiencing homelessness by 45%. In 1 year. That is huge. You may have heard Director Pratt early on discussing her indigent burial program, and that's the program where we get a lot of our data from, and then there's some advocates that also help with aggregating that information and making sure that our HMIS database is up to date. But that means people are thriving. Well, I won't say thriving. People are surviving. Also, another exciting thing that we were able to accomplish was asset management, providing asset management for Strobel. Just want to say that they actually won the Award of Excellence in the Urban Land Institute Award. And that was just maybe the day of the mayor's State of Metro that was announced, which is exciting. We're also the proud owners as asset management. We're the proud owners of the cold weather shelter that resides in Council Lady Jennifer Gamble's district. And I thank her and her entire district for welcoming us. This year was the first year that we were able to provide services as a department with the assistance of the health department. We partnered closely with the health department, MNPD, MNS, a lot of other community partners providing those services. But we reached a record number of 46 nights of sheltering for our first year. 51 of those guests were able to move into permanent supportive housing. The month of January, we provided 24 nights of sheltering, just the month of January alone. It's only 30 nights. And we're still responsible for daytime activities. So only 51 being housed out of cold weather shelters seems like a low number, but it was a huge feat for us, especially considering that 960 of those individuals had never been entered into our HMIS database. Other great things to celebrate would be connecting with collaborating with our community partners. We fund over 7 community partners within our Metro budget, and then we manage 11 ARPA contracts with 11 funded agencies. And this year, we also hosted 8 large community trainings and 18 resource fairs. One last thing that I do want to highlight, with all the great work that's going on here in Nashville, we were watching a Harvard training, and Jeff Olivet, who used to be the head of HUD and USIC, he made a really great quote, and I wasn't sure where he was going with it, but he said, they asked him, where do you see great work that's happening across the nation in homelessness? I've never met Jeff Olivet, and I don't know if he's ever been to Nashville, but we're gonna get him here. He said, I'm not sure of what's going on at the state level in Tennessee. He said, but I see great things coming out of Nashville. So I wanna make sure that our community partners know that their work is not in vain. last year, this is the 2024 numbers, we as a community housed 19 and 2 individuals. 891 were households with adults only, and 288 were households with children as well. Nashville is embarking on securing baseline data for a true depiction on homelessness. Working with community partners and creating new assessment tools to identify and prioritize housing comes with a cost. This budget's request focused on strengthening our FTEs, expanding permanent supportive housing and supportive housing, increasing critical gaps in housing, and enhancing emergency shelter operations. As a department, we're focused on chronic homelessness, ending family homelessness, and addressing youth homelessness. Our overall ask included administrative cost, funding FTEs. As you noticed early on, we have 16 employees that are funded by way of ARPA funds. Also, our overall ask included operating funding, which helped with, you'll notice, we work collaboratively with MDHA and the Affordable Housing Office of Planning as we addressed housing solutions in accordance with the new Unified Housing Strategy. So we're excited to say that there was some identified funding for non-traditional rapid rehousing, non-traditional operating costs for permanent supportive housing. Those are funding streams and tools that are identified by national best practice and national leaders. You'll see the budget mod here attached. And thanks to that administration, the mayor's office, and our finance team, and also to Mary Jo Wiggins. She works closely with us as well. All of the items here, there was a clear path provided, except for the things that are highlighted in gray. And other resources were identified by the mayor's office and our finance team. So excited to say that they're always looking for creative solutions. Revenue. This slide is what I'm most proud of. Not only do we as a department or we as a community come to Metro Council and ask for ways to secure additional funding, we also figure out ways to secure and bring on a braiding of that funding as well. So here you'll see that we have the federal funding, they increased. We also worked with MDHA and have a state and local, or have a local funding stream. But we also recently have a partnership with the state where we have identified individual placement support, which will help with accomplishing some of our systems performance measures in increasing the opportunity for individuals experiencing homelessness to have connections to gainful employment. We're excited about that state partnership. Also, go back one, sorry. Also, what I'm most proud of as far as the funding streams, this year, you know, I know there's a lot going on the federal platform, but this year we were able to get our local COC award to the highest that it's been ever. In the last 3 years, we have increased that award by $5 million. So this year, the local award is a little over $11 million that go actually directly to the community partners that we partner with and collaborate with. Our department is responsible for overseeing that work. I see one of the Homeless Planning Council members here. She's nodding. She's also on the performance improvement, performance evaluation committee as well. So that work is, as I say, it's not done in a silo. We collaborate with community partners. Our Homeless Planning Council helps to make tough decisions as it relates to the rank and the review, and the PEC, Performance Evaluation Committee. My hat's off to them for always being able to make those tough calls. So So this is where the justification starts, right? Chronic homelessness. At our cold weather shelters, 64% of the individuals were experiencing a disabling condition or domestic violence survivors. And also, what we know from looking at our data, for every one individual housed, 3 or more are entering into homelessness. There's insufficient medical care leading to dire circumstances. As we opened the Metro's first of its kind Scobey house, the first 3 to 5 out of the first 20 actually needed a live hospice care. They were going through medical treatment as far as chemo or dialysis while either residing outside in a wheelchair or in an emergency shelter. And a couple of them have since passed away because the chronically disabling condition had taken over. Also, the decrease in grant funding. As we are sunsetting our ARPA funds, we still have about 16 to 18 months of those funds. And then federal funds are unsteady as things are continuing to progress. Also, the decreased ability to expand prevention and diversion efforts. And with ARPA funds, there was an extensive amount of prevention and diversion efforts. Another thing that I would like to highlight here is for families experiencing homelessness, the state initially would fund partners that provided services to people experiencing homelessness. Those funds are still, so I'd say repurposed. They've been repurposed. They're still dedicated to Nashville, but just repurposed to other organizations. And so collaborations are looking to be made there. Also, we have state laws that are presenting new barriers. So new laws present new barriers. Plenty, or in 2020, there was some anti-sleeping bills. 2022, there's some anti-camping. 2024, there was the grants pass Supreme Court decision. And then in 2025, there was multiple pieces of legislation that obstructing a passageway, residing on commercial property or commercial land. And so as we're navigating those huge feats, we're also navigating historical compliance efforts. So you'll see that as a new department, to whom much is given, much is required. That's what I share and tell my team as well. As a new department in such a passionate space, unfortunately, we are tried, tested, and targeted a little bit as it relates to compliance and audits and financial reviews. This slide, we've been working closely with the National Alliance to End Homelessness and watching a lot of their work. And so in the last 3 years, we've been utilizing ARPA funds to help with progressing this work and moving this work forward. And so we've also noticed that PSH offers the highest benefit for the lowest cost. You'll see on this slide, PSH means permanent supportive housing. It offers the highest benefit for the lowest cost. As we operated the cold weather shelter, we were able to have a front row seat to see how dire the situation is. And in watching people coming in, sometimes they're coming in off of the hospital gurney or they're leaving, with the ambulance picking them up. And being outside in the elements is detrimental. NAEH has a study where $54,000 is what it costs per person per year to keep people that are living outside on the streets. And so what we see here in a funding with Scobey, $1.9 million annually is what it takes to house 90 individuals. And that gives us about a $21,000 to $24,000 per person range. Even in the interim housing, that still gives us a $25,000 to $27,000 range. Our local emergency shelter here, their average is about nearing $30 to $32,000 to provide ongoing services per person per year. And so you'll see this in this chart, combining housing with wraparound services like healthcare, mental health support, and employment assistance. This study shows for every $1 invested in PSH, cities have saved $2.70 on healthcare, policing, jails, other emergency services. And last but not least, what's next, right? So for us as a new department, we take pride in pushing strategy, reviewing data, and finding innovative solutions as we pivot towards successful practices. Not only is this garnering more funding on the federal level, but also national recognition for Nashville. We have been asked to speak at national conferences and consult with other communities on the great work that we are progressively moving forward here in Nashville. As a new department, we look forward to phase 3, sustainability plan for our robust funding portfolio for our community partners. And this budget strives to achieve just that. Metro and local service providers cannot resolve this alone. Increased connection with federal, state, and faith-based, and philanthropic community is vital. Here in front of you, we have 2 great opportunities. June 4th, we will have some national leaders here to do an all-day symposium on the state of homelessness here in Nashville. We have a lot of data. We have a lot of spreadsheets, a lot of things that we're going to be sharing. We'll share those with our Homeless Planning Council first, just to make sure that this is the data that our community would be interested in reviewing. And then also here we have on May 21st, the title is Slow Down to Go Faster, which is essentially a little bit of level setting for our community, figuring out ways to have a deeper, stronger connectivity and stronger collaboration. Excited for both of those. You should have already received this information from Demetrius. If not, there's places to RSVP, and we look forward to seeing you all there. Believe that is in. Once again, thank you for your time. Sorry if I went really long. Very passionate and excited about the work that we have going on here.
Thank you so very much, Director. And as I have seen hands go up, I am making a running list, so no worries, colleagues. If your hand went up, you have been added to the list. And again, Director, thank you so much for what you do and the services that you provide and what you're doing to take care of our most vulnerable population. I will start with Councilmember Evans. Did you have a question?
You know I do. I always do. Thank you all for being here. On the one thing I just can't remember, and something that you said sparked this question in me, when we're looking at homelessness and you are entering people into HMIS, is there a connection to the property that maybe the person came from if it was in Davidson County? So like, for instance, MDHA. Or do we know how many people you're entering into HMIS from MDHA properties?
We do not have that information. A lot of times by the time they've left MDHA, they don't just immediately go into living on the streets. A lot of times there's, like I always say, there's 3 things, right? The connection to the individual, connection to friends or family, or connection to community, church or faith-based sororities. There's a lot of places that people oftentimes can land. So the first place is typically not to living in an encampment. And it's kind of difficult or living in a shelter. I would say we do have information on the zip codes in which they actually came from, but not necessarily what location that they were exited from.
Thank you. Just thinking through that, some of the other information about like right to counsel and some of those other programs that we funded before. It's like how much of our issue is self-inflicted, from some of the like MDHA in particular, where there may be some opportunity for improvement to prevent some of those folks from getting evicted in the first place. It could send them down this trajectory where they end up needing to be in HMIS. So thank you for that. And then on the kind of discussion last week that came out about the proposed elimination of Section 8 vouchers and the kind of where we're headed, which I know we don't know, but the idea that it could pass through down to the state in block grants, maybe the amount of money would be less and that kind of thing. Do you all have like a doomsday scenario, like plan of if all these terrible things happen, like really what are, but projected increases of homelessness could look like, especially in conjunction with like all these state laws and things that have passed?
So that's a heavy question there, and it's a lot to unpack. So we're partnering on two folds, right? We're partnering with community partners and looking at doomsday scenarios as it relates to funding that they received as far as federal funds. But we're also partnering with MDHA and Dr. White and his team on addressing vouchers, subsidies. We locally have not been able to access or utilize vouchers probably since maybe October, November. So I'd like to always share with the community that we have to be able to house people with or without voucher subsidies. And they're, watching some of the information that's coming out may or may not have ongoing subsidies and or may not be time limited, which is unusual. The population that we serve, as I say, things are dire. The population we serve, there's not a bootstrap scenario of like pull yourself up by your bootstraps. Sometimes their chronically disabling conditions are long and persistent. And many, many years ago, there would be a space made available, right? So we're also inside of the SWAP committee, used to be called the shelter committee, looking at medical opportunities. There are long-term skilled facilities where people can land that's outside, that's not leaving people outside. I think also, as far as the projections, that's why two of our largest asks this year included, in working with Angie and the Unified Housing Strategy, it included the rapid rehousing, non-traditional rapid rehousing, which could allow and afford people like a non-traditional voucher subsidy, just in case situations like that was to arise. And knowing that we have not been able to utilize vouchers, I would be remiss if I did not say this month and next month, we have gained access to specialty vouchers that are for people with disabling condition, but a total of 25 to 30-ish that would be made available to us. But even that's still not enough. So the other operating costs that we're seeking is operating costs for PSH, whether that is master leasing, whether that is providing that service to a nonprofit that's able to provide those ongoing housing opportunities. In that triangle, you'll see that PSH is the cheapest cost for our city, and so we're looking to support that.
Thank you, Chair Evans. Director, I did have one question that I wanted to pose before we went through the list. Looking at your budget questionnaire, am I correct in, it seems as though your full ask has been funded either through the mayor's budget or through additional funding that was found, I believe you said, by Mary Jo Wigginson Finance and various funding models. So at this time, you are not asking the council to increase your budget. Is that correct?
That is correct. I would like to say thank you to the mayor's office and his administration. We could not do this work without him and our budget team. But as I say, to whom much is given, much is required. So we greatly appreciate having such a large ask and being met with not only yes, but let me figure out ways to make that happen.
Okay, thank you. Vice Chair Toombs, did you want to be recognized? You don't have to be, I just didn't. I wanted to get my vice chair before I got everybody else. Councilmember Gamble, you were the first person that I saw, so you're recognized.
Thank you, Chair, and thank you, Director Calvin, for being here and for the work you are doing and working with the community at the cold weather shelter. We appreciate you being so responsive to community concerns and keeping the area clean and secure. And so my questions revolve around the overflow cold weather shelter It looks like in your request, you requested 190,000 for operating the shelter. Congratulations on completing your first year operating the shelter. I know going in, you saw there are a lot of things that we need to do to improve. You're saying that you did receive this funding in the mayor's budget, is that correct?
That is correct.
Okay, wonderful. What kind of things will that fund, such as security and dealing with other things that you notice we need to get a handle on at the shelter?
Thank you for that question, Council Lady Gamble. So every year, we noticed in working with Director Pratt, every year, the amount that was set aside for cold weather shelter oftentimes did not meet the need. And this year, we were no different, right? So we had to purchase items that were repurposed for her nutrition program. So we had to purchase new items there. Every year, we lose a certain amount of either cots or mats just because of the and so repurposing that. It also covers all the way from warm meals. It covers security. Not only this year did we have unprecedented number of nights of shelter, and we also had unprecedented number of consecutive days back to back, and an unprecedented number of 24-hour days that we provided services there as well. And so, in looking at our budget and preparing the report, we just noticed that between 175 and 100 and 200K is kind of where there's a shortfall in utilizing that. There will be an RFP that we're working with procurement department on. And even if there's a department or an agency that was to apply for the RFP for cold weather shelter, our office will always continue to provide that level of oversight. But we just know, like from working with the health department and Delta T, which was a partnering agency as well, sometimes it's a little bit easier to, instead of offering overtime, because our daytime work did not end, instead of offering a lot of overtime, having some of that offset with other options as well. I think it's kind of how we were able to kind of keep it in budget, but it's still kind of averaged to be about 500K per year.
Thank you for that. And the way that the shelter is laid out is not the most conducive for you, where you're having to have additional staff because of the way that the rooms are closed off and that kind of thing. And we're working on that. Hopefully we'll be getting a new building at some point soon. My second question has to do with prevention services. You mentioned that you were wanting or hoping to increase services to prevent homeless. We know that there are a lot of people that are one paycheck away or one layoff away from being homeless. Will you talk about any funding that you're putting towards that and any programs that you have to address that?
Yeah, so not wanting to duplicate services as it relates to Metro Action Commission, Metro Social Services, but working with, it's called the CAN Committee, used to be known as the FAN Committee, Financial Assistance Network. Now I think it's the Community Assistance Network. And those are agencies like Ladies of Charities, Catholic Charities, Need Link, that actually provide ongoing services. In our office, we have the coordinated entry line, and we utilize that line to kind of triage, not only just to enter people into our system, but maybe it's someone that's calling because they need income, or they need not income, they need income, or they need rental assistance or deposits paid. So we use that line as a way to triage as well. If there's an opportunity in our budget by way of ARPA funds, we do have some deposits and things like that that we can assist them with. If not, we make the connection with Metro Action Commission and other organizations that provide that service. But we also, from MDHA, we have a contract with MDHA through the CDBG Community Development Block Grant, and that helps with deposits as well. So getting people out of homelessness into permanent housing, but for the prevention and diversion piece, we look to partner with other agencies that specialize in that.
Thank you, Councilmember Gamble. I now have Councilmember Johnston, followed by Councilmember Bradford, Councilmember Coopin, and then Councilmember Huffman. Councilmember Johnston, you're recognized.
Thank you. I'm glad to see there's a cash match for HMIS. I think the data is so important, and it really has been unreliable, I think is a fair point. We're getting better and better, and Hannah does a great job, so it is not a shot at the department at all. But we just in November started to receive information from the rescue mission. And so that shows how much hole we have there, and then also just having some consistency with case management so that we don't lose people when we lose a case manager that burns out and goes away, and that is happening quite a bit. And so I'm hoping that we can get much, much better there, because I think the devil is in the details and the details are in the data. I am a little bit concerned that these 18 FTEs, that we've moved some ARPA grant funding to pay for those FTEs. ARPA funding is by design one-time funding. And so it was never intended for that reason. I understand we're filling a hole there, but next year, that funding's going to be gone. And so we are literally creating our own cliff, and it's for 18 FTEs, which is quite a bit. And so I would love to hear your thoughts on the sustainability of that, or are we just going to be asking for another probably $2 million at that point to cover those 18 FTEs and possibly more? That it's not wise to do that. I understand why, but it's not wise. So, but I want to keep going. The operating funds, the $2 million for the PSH, is that supporting Strobel? Or is that PSH outside of Strobel?
So a little bit of both. The $2 million for operating cost, at this point in time, we have funding for ARPA funds that we're currently using for the funding of Strobel at this point in time. And so it would be a little bit of both. We would probably put out an RFP where it could be a master lease on certain units, because at this point we have funding for Strobel for this year. And depending on where we are with vouchers in the near future and other opportunities for, like, between the COC federal funds, there's opportunities there for braiding of funding, along with some home ARPA funds as well. So there's some competitive processes that will need to happen, and then we'll be able to make informed decisions on the other side of that. I think the reason we asked for it this year was because there's a huge need without those vouchers, and we'll be able to either do a master lease for operating costs for partnering agencies and get people off the streets a lot faster.
So this $2 million, because I'm going to ask about the 2.4 next, this $2 million, that's operating costs, it's not vouchers, right?
Correct.
Okay. So again, with ARPA funding, another cliff. So that's even more money, because I know that Strobel House is being funded by a lot of that. And so just for people at home watching, the cliff just got higher for next year. The $2.4 million, that is for vouchers, correct? To supplement the voucher program?
That is to supplement the vouchers.
Okay, because vouchers haven't gone away. We're just at 100% utilization rate, correct?
We are at 100% utilization, and some of the vouchers, like the EHV vouchers, are no longer made available to us here in Nashville.
And why is that?
Because they were ARPA. They came along with the ARPA funding.
Okay. Okay. The feasibility study that's listed here was not funded, correct?
No, but we received a clear path to work with the planning department for those feasibility studies. I think that we would probably work with them closely to get some TA to help with that.
Okay, perfect. Okay, let's talk about sustainability for the 18 FTEs. Like, what are we thinking? Because at this point, we're looking at several $1 million for next year that will be vanishing.
So for those FTEs, we would look at a staggered approach. We've offered, like, tiered process of how to fold them into our metro budget, and or utilizing some of those positions with some of the federal funds that we receive for our COC as well. So it would be a braiding of funding and or a tiered approach to have them enter into our funding season. I do want to say, while we're talking about staff, because I almost forgot, Hannah, you mentioned Hannah's name, and baby Ruby was born. Baby Ruby Cornejo Nell, weighing 8 pounds, and mom and baby's doing fine, for anyone that's wondering.
Thank you. I also want to just throw a shout out to our federal and state partners, because Chair Evans mentioned some of these chronic, or maybe it was you, April, that talked about some of these chronically disabling, that years ago we would have a place for them, and we no longer have that because that ended, 20 years ago or so. That is something that I think that we need to look at as a nation. We have people that are never going to be able to care for themselves, and it is beyond cruel that we don't allow for that. So I'm hoping that we can get some help there, especially when we're looking at HUD cuts.
Thank you for that.
Thank you very much. Councilmember Bradford, you're recognized.
Thank you, Chair. This is going to be a recurring question for each department. As far as your budget adjusted savings of 77.9, what would it look like if you did not receive that money back?
So I would pivot to my AD of Finance, but I would just say we're the budgeted targeted savings that was asked for. We're going to be ending our budget season very tight this year with the additional funding that was needed for cold weather shelter, with the additional funding that we've been utilizing. We've been utilizing a lot of ARPA funds to kind of help with budgetary needs as well. And so I would say that the funding that we set aside was to probably came out of like a a grant with Safe Haven or one of our partnering agencies. And so we would definitely need those funds to help with making our department whole.
Anything you would like to add?
Yeah, it's always going to be the programs that suffer when you take money out the budget. As you look at that 77,000, doesn't sound like a lot, but as we look at numbers of how much it costs to get people in the PSH, you're essentially taking it from that person and the resources that they are able to get. So anytime we look at our budget, most of it goes out, including our ARPA funds. So any reduction wouldn't necessarily be just for our department. It'll be for the community as a whole.
Okay, thank you for that answer. My second question, part of it was already answered under Councilmember Evans, but I want to kind of go deeper into that. It's about the data we're collecting on individuals entering our system. Are we collecting information as to where are they coming from? You said you are looking at zip codes. So based on that, what percentage of those entering our system and receiving services funded by tax dollars are coming from Davidson County, and how many are coming from outside of Davidson County?
So Hannah's not here, and she'll be mad that I don't know this answer because I normally remember every number that she gives me. But I believe it was like 89% the last time she ran the data on zip codes and people experiencing homelessness here, and what zip code did you come from, or what zip code, I believe it was close to 89%, but I'll make sure to send you all the exact number.
Okay, I appreciate that. And the last question, your slide mentioned that the number of unhoused deaths have decreased by 45%. Some would say that this year and the last few years, the number of those experiencing homelessness and dying experiencing homelessness has been the highest ever. Can you kind of explain, based on the data, the numbers, how we came up with 45% decrease in those that we've lost?
Absolutely. So this year, every December, we host a homeless memorial, and we call out the names of the individuals that are experiencing homelessness. Total names this year was maybe 114, 119. I did not bring that data with me. And the year before, it was 204. The year before that, it was 203. And so that's the 45% decrease in 1 year. Before that, the numbers within the last 3 years, the numbers were pretty high, around the time of COVID and those COVID interventions. But I think with a lot of the robust services that we're bringing on and our community partners, we've been able to really work on getting people out of the elements a lot faster, providing short-term temporary housing options along with cold weather shelter options. I think that it's been life-saving, along with Strobel coming on. It's been life-saving. So 45% decrease in 1 year.
And maybe a clarification of that is that we know of. Like there's probably some that individuals that passed away that we don't know about. But kind of following up, a conversation I had within Director Judy Tackett was we put a lot of effort into our cold weather shelters, and then we started doing the warm weather shelters. And I believe it was the floods in 22 or 23 that impacted a lot of South Nashville. I asked the question, like, what do we do? Do we have any kind of emergency shelters for our unhoused community for severe weather? Because we know whenever there's, especially with the floods, it's usually the encampments that are the ones getting wiped out because they're typically near creeks and riverbeds, thus prime targets for flash flooding. So where are we at with outreach and services during severe weather?
So it's a great question. Our outreach team works closely with other outreach teams across the community. We also lean heavily on Director Chief Swan and his reports that come out as far as weather, severe storms, flooding. We also work with the Water and Sewer Company as well, or Metro Water and Sewer Company. As well. Mainly, what we've learned over the last 3 years that I've watched and witnessed is typically people will not go inside if it's just rain, right? Or if it's just a storm, typically people will not go inside. It's actually when they go inside, they have to make a decision on gathering all of their items and taking all of their items with them, because when they come back, they may not be safe and secure as well. And so, 2 or 3 years ago, we tried to do seasonal sheltering and or extreme weather, and there was not very many people that would actually go in. There was way more staff there. Salvation Army had a extreme heat shelter. There was way more staff. I think in one day there was maybe 15 people that actually went into the shelter, and that was kind of on a rotation of 24 hours, not all 15 at one time. And so, and you probably remember on that triangular slide, we know that it is more cost effective to have PSH or to bring on housing opportunities. We would spend a lot of money on temporary solutions if we tried to do all of those things. And so our team goes out whenever there's a storm, notifies the individuals of storms. We provide bus passes. We also provide dispatched rides. We utilize mobility solutions to provide dispatched rides if an individual, say if the storm comes in and they said, hey, we're going to ride it out, but then they feel like they're not safe anymore, then we will actually have a number. We send out a text alert where they can have a number to call for a ride to either our community partner, depending on the time. It could be the library or Nashville Rescue Mission or Room in the Inn, depending on the times.
All right, thank you. And just one last brief question in regards to the warming shelter 190. You mentioned before that part of the increased cost this year is because we've had to replace items. Are you looking at, as when you're planning your budget for this year and when you go into next year, are you planning for that shrink so that in future years, it's not going to be that much of an increase? Like there'll already be funds budgeted to replace bedding, to replace cots, et cetera.
Yeah, we're in an active conversation with Granger and kind of looking at the warranties that are placed on some of those things and trying to find the right product. When we got the shelter, we noticed those gaps that we needed immediately. So it was kind of like a push of time to get some of those stuffs in. But ever since we've shut down and kind of counted and did inventory, we're looking at suppliers that can provide things that have multiple year lifespans.
All right, thank you.
Thank you. Councilmember Huffman, you're recognized, and then Councilmember Coopman, you'll be next.
Thank you, Chair, and thank you, Director, for coming. It's y'all do really great work in the community, and I've got a great relationship with my outreach person, Lakeisha, out here. I actually just texting her right now about a situation that we had earlier, and she was able to get someone some resolution. So your team does great work. Just one quick question, and it's really about the bus ticket program. Where is that in regards to the budget process? Is that funded? Is that through some kind of special partnership through WeGo? How does that work?
So in the past, we would purchase bus tickets, and we had an MOU with WeGo, and WeGo would offer a certain amount of them for like cold weather season or extreme heat season at no cost. So it was a little bit of give and touch for both. We're excited with the new transit reform. We have been asked to have someone sit on the advisory council to explain how our individuals actually utilize the bus. I think that our unhoused individuals have the second highest level of ridership of WeGo. So we're excited for and we have our emergency services manager, who's the one that's buying those bus passes, helping with the seasonal demands and operating our cold weather shelter, Tatiana Ruffin, and she fully understands the needs. So I think that hopefully within the next 3 to 6 months, though, that would look a little bit differently.
Great, thank you. And just also wanting to point out that you were a D14 resident in regards to your location of your office, and that actually saved the city a little over $146,000 a relocation at District 14. So we have more office space out there. Thank you.
Thank you.
Thank you for that plug, Councilmember Huffman. Councilmember Cooper, you're recognized.
Thank you, Chair, for recognizing me, even though I'm not on the committee. And I will say, I appreciate y'all being out in D14, but D19, you can get a little smaller, but right in the core of the city. So highly recommend that real estate as well. Want to thank you for all your contributions and hard work. I know you guys do tireless work for our community and really appreciate you and your team and all that you're doing. It's not an easy job and certainly not one I envy. Couple of questions. First of all, you've talked about permanent supportive housing. Can you talk about any specifics on potential projects you're looking at or places you might be looking to do PSH? Or I know Strobel's been a really great success and there's many that would love to take part in that. So curious if you can give some specifics there.
So Strobel has been a huge success because we would probably put this out as an RFP. I don't know if on a recorded line, I would want to say that we would, want to vet a property or a developer. We also, working with General Services, I should also, share that Director Gerald Smith and his team has been awesome to work with throughout cold weather season and now. But we recently, several times, we'll get developers or hotel owners or people that own properties that would want to connect with us and partner with us as well. So some unique, innovative opportunities lie ahead. We just got to continue to vet them, and there will be a RFP process for that.
Thank you. And we've talked a lot about religious institutions that have large pieces of land doing affordable housing. And so I'd wonder if there was a institution that wanted to maybe explore using their land for permanent supportive housing, would it be best to get in contact with your office or somebody else, or what would that look like?
I partner with Angie. I say she's great for the sticks and bricks, right? She understands the development language, and we're much more around the supportive services and the people and the soft skills. So maybe I would say start with her, and a lot of times she'll pull me into that conversation, especially now that there hopefully will be some funding for feasibility studies. So this is an exciting time right now.
Thank you. Just a couple more, and I imagine that probably more directed to sticks and bricks conversation, but looking at potential permanent supportive home ownership, something I'm really passionate about. When you look at, a couple $100,000 to build a unit and then $20,000 a month or a year to operate a unit, which is about $1,600 a month, I start to look at how much a down payment on a house is and how much a mortgage could be. So just something to put on the radar. I know it's probably more Angie's side of things, but you could get, $50,000 down payment and then $1,600 could get you a permanent place to live where the market's doing the work versus us kind of suppressing it. So just something to put on the radar. And then I think my last question, apologies if this was answered already, but cold weather shelter, I know we talked about potentially down the road, some updates or upgrades or maybe some renovations going on. Can you speak to any of that yet, or is it kind of too early to discuss that?
I would say probably a little too early. I'll pivot to Council Lady Gamble. A little too early to share. Still in the feasibility study phase. But I think it's going to be great in the end.
Perfect. Well, that's all I've got. I appreciate it. Thank you.
Thank you. Seeing no one else in the queue to be recognized. Councilmember Chair Evans, did you want to be recognized again? No? Okay. Well, with that, Director Calvin, thank you so much for the work that you do for some of our most vulnerable population and constituents and for the love and care that you show to the unhoused community. We thank you for the work that you do and thank you to your team. And with that, colleagues, we are going to end this session and begin our last session, which is health. That can be found in your digital budget book. Just a moment to get everything set up, colleagues. So this is a great time to take a quick break if you need.